Hi, and welcome to Uniquely UCF Sociology, a podcast production of the Department of Sociology here at the University of Central Florida. I'm your host, Dr. Ramon Hinojosa. Uniquely Sociology is a podcast that explores the research and creative efforts of those who are doing the good work of sociology. Do you want to know what sociology is and what contributions sociology makes to improving our lives? Well, then you've come to the right place. It's Uniquely UCF Sociology. Today, I'm speaking with Dr. Jaqueline Woerner, an assistant professor in the departments of sociology and psychology here at the University of Central Florida. Dr. Woerner currently directs the Social Theory, Relationships, and Interpersonal Violence Exposure Lab, or the STRIVE Lab at UCF. Her work broadly seeks to explore the psychosocial precursors of risk-taking, aggression, and violence, and she's published in many of the leading academic journals of the day. Hello, Dr. Woerner, and welcome to the show.
Hi, thank you so much.
So let's begin by asking where and when you attended school for your PhD, and maybe a little bit about what your dissertation work focused on.
Yeah, absolutely. So before I came here, I earned my PhD in social psychology in 2017 from Wayne State University in Detroit, Michigan. And then between there and coming to UCF, I did a 2-year NIDA, National Institute of Drug Abuse postdoctoral fellowship at the Yale University School of Medicine in their Department of Psychiatry. And in terms of my dissertation, this is an interesting question. I have not talked about my dissertation in a very long time. I actually never even tried to publish it. So you're in for, this great inside information here. But very broadly, my dissertation was aimed at kind of understanding the effects of social rejection on stress reactivity and sexual risk behavior and tensions among women, and understanding how those pathways vary based on victimization history. So this was a experimental study where I randomly assigned people in the lab to either a social rejection or inclusion condition, using a task that many others have used to kind of elicit these feelings of social rejection, and looked at how that was associated with both psychological and physiological indicators of stress, right? So for psychological stress, kind of these self-report measures of how stressed people were feeling in that moment. And for physiological stress, looking at cortisol reactivity, so taking some saliva samples and seeing how that that changed kind of from the time that they came in to kind of later in the study after being rejected, and then kind of seeing how this is related to different sexual intentions. With this idea here that people who are engaging in certain sexual behaviors might be doing so to, cope with, distress in some ways, particularly after interpersonal harms like rejection that could help kind of restore social connections. But understanding how all of this kind of differs based on victimization, especially when we're thinking about stress, right? That there's a lot of different ways that people respond to stress. So you're seeing that some people kind of have these blunted stress responses where they're kind of, desensitized to a lot of these kind of experiences of interpersonal harm after experiencing them for so long. And others, you see the complete opposite, where they've got these elevated stress responses where they're more hypervigilant and more readily anticipate and respond to different stressors, particularly interpersonal stressors. And sometimes these psychological and physiological pathways don't even really map onto each other very well. So it was a little bit of, a really interesting study in terms of learning a lot from it. But like I said, I never published it. Lots of, just kind of confusing, I guess, inconsistent type of results that were hard to kind of wrap my head around. So yeah, a long time since I've told anybody about that.
Well, I'm sorry to dredge up the past, but it does sound like your dissertation work really set the stage for the STRIVE Lab, right?
Mhm.
Because you're dealing with relationships, you're dealing with stress responses, you're dealing with how people make sense of those, and things like sexual aggression and violence, particularly when it comes to varying forms of masculinities. So maybe you could tell us a little bit about the STRIVE Lab and some of the work that you do there, and what sort of things you're finding.
Yeah, for sure. So My research is really broadly focused on this intersection between interpersonal violence and engagement in health risk behaviors, particularly substance use and sexual risk behavior. And when I say interpersonal violence, I'm really using this as a broad umbrella term to include things, of course, like intimate partner violence and sexual violence, but also things like discrimination and social rejection and other types of interpersonal harm. And in our work, we try to understand how these different types of interpersonal harm are related to various health behaviors and health outcomes. Kind of with this goal of being able to identify some protective factors that can help build resilience and some types of interventions. But at the end of the day, if we're thinking about preventing and stopping violence, we need to focus on perpetration. So actually more of my work is focused on the perpetration of violence. And understanding when and why violence occurs, who is most likely to be perpetrating this type of violence, and looking at some individual level factors like personality characteristics, situational factors like whether people are drinking, relationship characteristics between the victim and perpetrator, as well as some kind of broader societal risk factors like thinking about gender norms and things like that. And across all of this work, I'm really interested in health disparities and understanding kind of how these different relationships look different based on various identities, particularly gender and sexual identity with a lot of this violence-focused work, as well as race and ethnicity in terms of thinking about discrimination. And really with the goal of that is to kind of identify some of these unique risk and protective factors that can help ultimately inform some of these more tailored, effective interventions for different groups.
Fascinating. And so I know that you're affiliated with both the departments of sociology and psychology at UCF. And so you can really hear in your work, you've got the intrapsychic components, you've got some of the social and cultural factors. It seems as if your appointment at UCF is really a perfect marriage of everything that you're doing.
Yeah, so I was actually hired for an interdisciplinary research cluster on violence against women, right? We're so hiring a bunch of people who are invested in understanding and ending violence, regardless of discipline. So I really have this interdisciplinary training. Like I said, I got my PhD in psychology and then a postdoc in a school of medicine and now work in sociology, which I think really affords a lot of great opportunities for collaboration and bringing together different perspectives. But that also means when I run my lab that I've got students from different disciplines as well that have very different career trajectories, very different interests from each other sometimes. So even if my program of research can kind of make these connections, sometimes the students are a little bit more narrowed in their approach, which can be a little bit challenging in terms of having lab meetings and collaborative projects. But I do think it brings a really great strength. And then in clinical psychology, I'm also part of what's called SURGE, or the Substance Use Research Group, which is a collaboration of 4 different research labs that are all focused on substance use. So, I've got one group that's very violence focused, one group that's very substance use focused, and then my lab kind of just brings all of this together and, in particular, brings in a lot of these sociological aspects.
That's fantastic. So if we have students or potential students who are out in the audience listening and they're thinking about attending UCF to study with you, what can they expect?
Yeah, good question. So, I think in terms of research interest, there's a lot of different options there. But again, kind of something that's focused on that intersection of, interpersonal violence, very broadly defined, and substance use, kind of with this focus on health disparities. I think anyone with those interests could very well fit into my lab. I think this interest in interdisciplinary collaboration so that everyone that's going to come here, of course, is affiliated with the program, whether it's sociology or psychology or really anything else. I work with a lot of undergrads and other departments too, like health sciences and biomedical sciences and things like that. But really kind of an interest in kind of learning different perspectives and reading literature, research that might not necessarily be in that discipline that you're studying. And we have really like a team-based approach to things, right? We meet bi-weekly as a group and have meetings to kind of talk about different projects that we're all working on, but also lots of professional development type of things like conferences and networking and, all of these kinds of things that are really central to students' development beyond just the research side of things. And I build in kind of like a tiered mentorship approach to my lab too, where graduate students get an opportunity to mentor undergraduate students that then I kind of meet with the graduate students to kind of help them develop those mentorship skills. And because I have such a large team of undergrads that I don't necessarily have the time to meet with every single student every single week, that it gives them a lot more one-on-one mentorship with graduate students. So I think really just that focus on collaboration and team science is a big part of what it means to work in my lab.
Oh, fantastic. So students are getting an interdisciplinary education. They're getting part public health, part medical education, part social cultural education, information from psychology, and they're interacting with students across all these broad disciplines. And also mentorship. I mean, it sounds phenomenal. Do you actually have any space in your lab for me? I'd love
yeah,
to
come on
down.
down.
Oh, that sounds exciting. I wish I had access to that sort of learning experience when I was an undergrad or even a grad student. It sounds like you've really sort of embraced this emerging interdisciplinary approach to doing research, which is fantastic.
Thank you. Yeah. And I think it's really great for students' well-being too, right? Like when I think back to my lab in graduate school, the other students in my lab to this day are still, some of my best friends and biggest supporters. And, these are people when you're thinking about applying for jobs or applying to graduate school when you're an undergrad, that you have this built-in set of, resources, both professionally, but you also kind of have that social aspect too, where you're all going kind of through the same thing together. So I think it's really helpful is, I think graduate school and, undergrad as well can be really stressful for people. So kind of having that group to help navigate that can be really beneficial.
No, for sure. So you're actually putting into place the practices of social support amongst community members experiencing similar things, and that's fantastic.
That's a good way of putting it. I like that.
And so the students that work in your lab, it sounds like go on to graduate school, or they may go on to careers in public health, or, and I certainly don't want to put words into your mouth. So perhaps you could tell us where these students go and the sort of things that they may go on to do.
Yeah, good question. So, I will, of course, note that I'm pretty early in my career, so I haven't had tons of students that have, graduated and left my lab, but you're right, they have gone on to a variety of different things. I have some undergrads who are in psychology graduate programs, mostly focused on clinical psychology, actually. Several of the sociology master's students who worked in my lab are now in sociology PhD programs at other institutions. One of my honors undergraduate thesis students is starting medical school this year. So yeah, all different kinds of things, really.
Oh, that's excellent. And so you've set these students up well for their future successes, and that's very exciting. And so the last question that I'll ask you is, for the audience sake, if you were to pick a article or an article, excuse me, or a piece of creative work that you're most proud of to share, what would that be? And I don't want to put you on the spot, so if you don't have an answer, that's okay.
Yeah, so I guess what I could say to this, is especially for people who are newer to, reading research and kind of understanding and just kind of want an introduction to what I do, right? So a lot of my work is focused on the role of alcohol in sexual violence perpetration. So I have one review article that is focused on the role of alcohol and men's sexual assault perpetration, kind of integrating findings across different survey and experimental research that's published in a journal called Trauma, Violence, and Abuse. that really kind of helps understand this, right? Because this is such a major issue when we're thinking about alcohol facilitated sexual violence, right? We know that over half of sexual assaults tend to involve alcohol in some way or the other, but we also know that alcohol doesn't directly cause people to become violent, right? That this is something that like we all can associate, that we know that they're kind of co-occurring. So a lot of what I do in my work, and I think is explained pretty well in this paper, although it's a few years old already, but I think still kind of provides a nice overview of some of these ideas and kind of thinking about all of these different things, like, you know, the role of the person, right? Or there's certain people who tend to kind of be doing these types of things. What about alcohol itself, right? So if it's not having this direct effect, what is alcohol doing, right? So some of this is about the expectancies that we have about like, what do we think alcohol is going to do, and how that can kind of become like a self-fulfilling prophecy, where if we think alcohol is going to make us more sexually willing or more aggressive, then sometimes it does. And we can kind of think about how that fits in with some physiological aspects of alcohol and things like that. But we also talk a lot about, you know, the social environment, right? This shared context of sex and drinking, right? That people are out in you know, bars or parties where both alcohol use and, you know, violence and risky sexual behaviors are likely to occur. So kind of just putting all of those different pieces together, I think is a nice introduction in this paper to really just understanding that relationship a little bit better.
Excellent. And some might suggest that because this is a college, a large university, that some of those issues might actually be happening amongst the student body as well. And so,
yeah, absolutely. And some of the newer stuff with this too, we've been doing a lot of like technology facilitated types of sexual violence and understanding the role of alcohol there, right? So when we're thinking about alcohol and violence, it's usually, you know, you're face to face where you're drinking and you're reacting to what's happening right then and there. But when we're thinking about these things happening online or through dating apps or something, well, one, what does that violence really look like? And what are the effects of it? Why are people perpetrating this violence? But also kind of how does alcohol fit into that when you're not face to face with somebody, and there might be that delayed reaction where someone's not responding to you, you know, immediately after you're angry or something like that. So, and of course, you know, differences by, you know, gender and sexual orientation. When we're thinking about this literature, historically, a lot of it is focused on, you know, men perpetrating against women and really understanding, you know, how this looks different across different groups and, you know, across different types of technology.
oh, fantastic. Well, I would love to read that review piece, Dr. Woerner. And if you would care to share, we'll put it in the links for the audience and they'll be able to access it and get a sense of the sort of research that they might get involved with if they were to come to study with you.
Yeah, absolutely. I would be happy to share that.
Okay, excellent. Well, Dr. Woerner, I would I'd like to thank you for taking your time today. I appreciate you sitting down and having the chat with us.
Thank you. It was great to share more about what I do.
Excellent. And I'd also like to thank you, our audience, for taking the time from your busy day to listen as we discuss all things that are uniquely UCF sociology. This is Dr. Ramon Hinojosa saying thank you, and we hope you'll join us next week. Have a good day.